Hello everyone, this is Dr. Hasna brought to you by UKMLA Academy, and today we're doing the tummy or abdominal examination. But once again, let's be layman in this exam. Let's call it tummy for the sake of patient. And I'm telling you this because I've seen a lot of people making this basic mistake. Abdomen is something that the patient does not understand. You have to use simple terms that patient understand. We're doing the tummy examination today, and how do we begin the tummy examination? I've already told you the examination structure. It goes with the E square, C square, P square approach, which is, I would like to have a look at your tummy today, Mary. Explanation. It will involve me looking, feeling and tapping, maybe even hearing some parts of your tummy. Will that be okay with you? Consent, done. Is it okay if you could expose and position? Position is lying down, bare below the breast, all the way till your mid-thighs. This is the ideal position for tummy examination. Could you do that for me? And finally, I will have a chaperone with me to maintain your privacy and dignity. Let's get started. So whenever you do tummy examination after the E square, C square, P square approach, don't forget that that's the most important part to be a safe doctor, is you will inspect. Alright, so you're going to go to the bedside, to the end of the bedside, and you're going to inspect for any scars, any distension, anything obvious that is visible, maybe some movements you can see, maybe you can see a hernia, maybe you can see anything, any swelling, all of those things. But make sure one thing, do not verbalize what you're seeing in this exam. Just go inspect. That's about it. So for me, I would go here and I just inspect, and then I come to the right side of the patient again. Next is the palpation, and always remember guys, palpation always starts with the temperature and then you go to the palpation, actual palpation. Okay, so now make sure you warm your hands. Make sure obviously you should be gloved before the procedure, examination. Alright, Mary, I am going to just feel your temperature on the tummy. I will touch you very gently. You're gonna compare it with the mid thighs, at least 4 quadrants. Check their temperature, compare with the mid thighs. Next is superficial palpation. Alright, Mary, I'm just going to lightly touch you. Do you have any pain anywhere? Okay, this is what you're going to be saying to the patient. No, I don't have any pain, or maybe if I have pain, then you avoid that area. Okay, I'm just going to touch you very lightly and look at the patient's face. Okay, and you're doing it actually very lightly. You're looking at the patient's face. If the patient's sitting there, look at his face. Any pain, Mary? And what are you palpating? You are palpating the 9 quadrants of the abdomen in an S-shaped manner. Keep that in mind, okay? Because I've seen many people mess this up. So, any pain? So, superficial palpation. Next, you go for deep palpation. In deep palpation, okay, Mary, I will get a little bit stronger with my touch. I will push in a little bit harder this time. Alright, if you have any pain, let me know. Same, look at the patient, and this time, now how do you perform a good palpation? Your hands, your fingers should not be poking. So many people do this wrong. It's not, you're not poking. You're going to be entire palm and your finger all will be pressing inside and feeling for any mass. Your hand should be like this, completely perpendicular, your hand to the elbow, to your forearm. Alright, so you're going to be this time going deeper, even 5 to 6 centimeter deeper, but in all quadrants in an S-shaped manner. Make sure you don't mess this straightness. Coming here, looking at the face, looking any pain, John, Mary. Alright, done. Now let's go for the special test. Special tests include seeing if there is any kind of liver or spleen megaly. Alright, so now what you're going to do, you're going to keep for liver, assessing the liver or palpating the liver. What you're going to do is you're going to put your hand in the lower quadrant of the tummy. Okay, lower quadrant of the tummy, and you're going to ask him to breathe deep in. And as he expires, you're going to take your hand in. So can you, Mary, can you take deep breaths for me? When she inspires, don't do anything. When she expires, palpate. Okay, and then for the next palpation, get ready and go higher. So usually when you go inside and when she inspires, you feel the edge of the liver, and when you feel the edge of the liver, okay, I feel it right here. This is the costal margin. You measure how many centimeter below the costal margin if it's enlarged. Next thing is the spleen. You do the same thing, but this time you start from same area, but you go towards the left hypochondrium, doing the same inspiration, expiration steps. Now we come to the special tests in special conditions. If the patient complains of an upper abdominal pain, then perform the Murphy's sign. What is the Murphy's sign? You press deep in. Now you ask the patient to inspire. Okay, so you press the right hypochondrium region, you press deep in. Okay, Mary, I want you to take a deep breath. When she will take a deep breath, you'll feel her wince or stop. She won't be able to complete that breath. This is called a Murphy sign positive, which you'll see in all conditions of, especially in acute cholecystitis and bladder conditions, gallbladder conditions. Next is if she's having lower abdominal pain, then you do a rebound tenderness check. Alright, Mary, any pain? And rebound tenderness means when you lift off your hand, there's going to be pain. Okay, next is percussion. Alright, now you're completed with the palpation part, you go to the percussion. How do you percuss? From the epigastric region, keep your middle finger inside, percuss. Go down. You're waiting for the note to get dull because that's where your bladder is. Okay, once you're done with this percussion, now you go for the checking of fluid in the tummy. Very important. You go laterally. Percuss, 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 go laterally. Normally, this should be more resonant, but the moment you feel any dullness, what you need to do is perform a shifting dullness test. You're going to say, okay, Mary, suppose this is a dull percussion note. I want you to just flip over to your left side for me. She will flip over for you. And what you'll do, you're going to wait for a while. You're going to percuss again. And this time you'll feel a change in the note from dull to resonant because all the fluid has gone to the other side when she turned in the lateral position. Okay? The moment you resonate, then you perform, you take it back to the other side. And when you take it to the other side, again there's going to be dull percussion note right over here. This is what we call a shifting dullness. It is positive in heart failure, in any cases where there's ascites, maybe because of cancer, maybe because of many causes, alcohol, liver disease, all of that. Could be cancer, could be ascites. Alright, so these are going to be positive in ascites. Okay, once you're done with this, for instance, you're performing a regular person does not have fluid, you still need to perform the shifting dullness. If you don't hear any notes that is dull, you just don't complete the shifting dullness, you don't need to perform it. Now what you're going to do is you're going to quickly auscultate the tummy at the ileocecal valve. You can do it at the umbilicus as well. I would like to hear your tummy sounds. And that's it. Tummy signs will be reduced, either reduced or hyperactive or exaggerated in cases of intestinal obstruction, and obviously tummy will be tender all over. Alright, so these are the main tests. The main diagnosis in tummy is once again all over tenderness with exaggerated bowel sounds or absent bowel sounds, intestinal obstruction. Any patient having right hypochondrial pain with Murphy sign positive acute cholecystitis, or if right hypochondrial pain with any other symptom, maybe jaundice, then it's acute cholangitis. Any patient with fluids, it's heart failure, it's alcohol, liver disease, any mass felt, most likely pointing towards cancer. Rebound tenderness positive could be in appendicitis as well as pelvic inflammatory disease. But remember one thing, that the patient's history is going to guide you, so take good history. Alright guys, and if shifting dullness is positive, a point that I missed, if shifting dullness has come back positive, make sure you perform the fluid thrill test as well. How do you do that? You ask the patient to put his hand right in the center of the tummy, just like that. Alright, like that, you just guide them, you can put their hand. What you need to do is, you're going to have two hands over here. From one side, for instance, this is how you're going to perform it. You're going to put your left hand on the right side, and from the other hand, you're going to flick the tummy, and you're going to feel a thrill on the other hand. You can perform it either way, or you can do it like that. This means the fluid is quite a lot in quantity. Otherwise, normally shifting dullness is enough, but if it's a lot of fluid thrill also comes back positive. You feel the wave or pulse of the flicking. And once you're done with the abdominal examination, you've completed it for instance, don't compromise the step of saying, thank you so much Mary, I would like you to cover up now. Or if Mary is not here, it's a mannequin, you cover up the mannequin. This is a very important step. Usually people neglect the last steps, but we're not going to do it because we watched this video, right? And make sure that at this point, you're going to tell that ideally I would like to have examined your external genitalia, your hernial orifices, lower lymphoedema, and a back passage examination. At least verbalize if possible. This should be said at the end, just in case, because abdominal examination is not incomplete without the hernial orifices, genitalia, and especially your DRE. So make sure you verbalize it. Thank you so much.